It's just saying starting. Yeah, I think it has begun. So the recording has started and we will crack on with our session for today. So thank you everyone for joining us once again, and I'm going to hand over straight to our first speaker, who is Dr. Mehmet. So Mehmet, you should be able to take control of the slides. Let me know if you're able to do that. Yes.
Yeah. Thank you, Zain. So good afternoon, everyone. I'm Mehmet, and I'm a senior educational psychologist at OneEducation, and I oversee mental health and well-being. Today, I'm going to speak to you specifically about training that we're offering in conjunction with the National Network of Mental Health Leads. So they're the consortium leads, and we're working with them in partnership to deliver localized support to mental health leads in schools. So I'm just going to talk to you through that. If I'm going too fast or too slow, feel free to make comments in the chat so I can respond to that. Similarly, if you want to ask questions, just ask as I'm talking, or put them into the chat. Zain, if they put them into the chat and I miss the questions, would you mind just raising them with me either at the beginning or the end? I'm going to have to leave at the end of my talk because I'm in my service development day today, but I'll add my email in, so if anyone wants to contact me outside of that, they can. So I'm sure, given the group here, everybody knows what a designated mental health lead is. And obviously in schools, as that's developing, there's now sometimes the designated mental health lead and someone supporting them as an assistant designated mental health lead. But just a reminder that the training course is aimed at the perspective of this not being a clinical role. It's for people within schools who are overseeing and signposting to mental health and wellbeing provision, and covering the needs of all of their student population, not just those who are experiencing or demonstrating their needs. It is expected to be someone within the senior leadership team of the school. I'd just be interested to have like a thumbs up if you, as the designated mental health lead, are in senior membership within your school, just to get a sense of if that is reflective within the Manchester context at the moment. I'm assuming the hand up is a thumbs up, but if it's not, we'll go to Jenny to ask us the question. Yeah.
Yeah, I think the hands up are representative as thumbs ups. Yeah. So.
Yeah. Yeah. And obviously within Manchester, healthy schools have been offering mental health leads training as part of the standard package to every school within Manchester that is within local authority or grant maintained. But actually the Department for Education has released extra grants to schools to be able to access more intense training as well. So what we've done is in order to complement the offer of what Zain's service has been offering is we've worked alongside the consortium to offer more detailed training than can be covered within this forum, but to complement it and not duplicate it. I'm sure a lot of you are aware of OneEducation. We're one of the largest education providers within the Northwest. Our services include educational psychology, SEND, emotional trauma support and welfare support, as well as HR and IT. The educational psychology service is part of the M5 in Education partnership. So we work alongside our team, Healthy Schools, Manchester Mind, 42nd Street, etc., as part of the M5 offer to schools. And as a service, we've got in-depth knowledge and experience of working closely in the Manchester area and within whole school approaches to mental health and well-being. I can see someone's got a hand up. I don't know if that's a question or whether it's just a historic hand up, so I'll just pause in case there is a question.
That's from Alexia. Is that a question you've got, Alexia, or is it just a hand up from before? just hand up from before, I think. Yeah, no worries, that's fine.
So the consortium leads that we're working with to provide the training are National Network of Mental Health Leads, and as part of their service, members get a 2-day national conference. There's a helpline, there's professional development activities and resources to members, and they are one of the largest providers of the mental health training nationally. I think they've covered around 2% of all schools within England in terms of this training. So the consortium have got a lead within this schedule of work. So what we're offering locally are 3-day advanced course for senior leaders, and a separate one which we call the advanced course there, which is for people who aren't within senior leadership of the school. The courses are very similar. It's just that because it's a discussion-led course, and it's better to have people with similar roles thinking about issues that are more relevant and pertinent to them. So the cohorts are split between those who sit in senior leadership in schools and those who do not. So the 3-day senior leadership course is for head teachers, deputies and other senior leaders who are also the designated mental health lead. And the course looks for in-depth coverage and discussion of the multiple facets within mental health within your setting. And it definitely isn't 3 days with you sitting there listening to myself and the other facilitators talk about what we know. It's definitely bringing up our shared knowledge and expertise from each other, and the facilitator is very much helping keep that on track and to build on where you already are as a school. It covers the requirements for mental health lead training, applied ethos, culture and staff well-being. So the senior leadership course very much thinks about the more broader issues that are relevant to senior leaders within schools. The modules, and I won't read them all out to you because you can see them there, but there are modules that we cover over the 3 days, and for each of those modules you would complete some self-study and keep a portfolio to show evidence that you're meeting the requirements to become a certified lead. Participants completing this will also earn a level 4 certificate in mental health aware leadership and a certificate of meeting the requirements of the role. The 3-day advanced course, as I've said earlier, is very similar, but it's for people who are not within the senior leadership team, but who are already in role of mental health leads. They should normally have some basic or introductory training or experience in the role. That said, we are able to kind of meet the group's role. If you know that is your role and you don't feel you've had too much experience so far, we could support you through that as well. So then in terms of the dates, and these are all the Manchester dates that are available at the moment. The first senior lead course will start on the 12th of January, March and 27th of April, and it will be face-to-face at Universal Square. And the advanced course would start on the 23rd of January, the second day on the 6th of March, and the last one on the 9th of May. You can book your places directly, and it will signpost you how to get the DFE funding through the mentalhealthlead.com website. So you can us through there. If it's helpful, I could, if Zain gives me control of the screen, just show you how to do that if people would find that helpful, but I'm assuming people could navigate their way around there. I've aimed to keep this as succinct as possible today, but give you an opportunity to ask me any questions. So I'm just going to stop now and invite either written or verbal questions.
Thanks so much for that, Mehmet. Really appreciate that and your time today, this afternoon. Has anybody got any questions they would like to pass on to Mehmet whilst we've got a bit of an opportunity whilst he's still around?
Hi, Zain. Can I just ask what the cost of the course would be for the senior mental health lead training?
Yeah, so it makes £12,000, sorry, £1,200 available to the school. Around, I think it's about £800 goes to the training of the course. So you pay that to the consortium when you've received your invoice for that, and then there's about £400 to backfill some supply within the school. So it's funded, so it shouldn't cost you anything.
Can I just double check? I think I already know the answer to this. If the school's already received that funding in a previous year, they can't get it in a new year.
That's my understanding, but to be honest, I'm not 100% sure. So if you wanted, I could give you the consortium leads email in the chat as well before I leave, and you could ask them, because I think that they will know that. Yeah.
Okay, brilliant. Thank you.
Any other questions?
I think we might.
I can't see.
Okay.
Has anyone here attended the course that I facilitated or Catherine facilitated last academic year? Can't see the list of participants, I'm not sure.
No worries. Let's just have a look, see if anyone's mentioned anything. I've reacted. Doesn't seem like it so far, Mehmet.
Okay. I was just going to ask them to share their views if there was anyone in it, if they wanted to, but that's fine. So I will just add on that my email is on the chat anyway. So if you have any questions you want to ask outside of this meeting, please email me, and I will give Anita the link to the consortium lead so she can ask them about the funding. I think the answer is no, though, essentially. Is that okay?
That's perfect. Yeah, thank you so much for that. Really appreciate it.
Thanks for letting me join today, and I look forward to seeing you all in due course.
No worries at all. Thanks for that, Mehmet. Appreciate your time. Thank you. And everyone's got Mehmet's email address there as well. So if they do have any questions you'd like to follow up on them, please feel free to drop Mehmet an email. So thanks for your time. So I'm now going to hand over to Sarah Smith, who is here from Child Bereavement UK. Sarah's going to be sharing her own slides. So Sarah, are you able to do that?
I am, just bear with me.
No worries. Oh, we've got your inbox open up, Sarah, there.
Oh, it shouldn't be, I'm on. Bear with me, have you got that one now?
Oh, it's just changing over to something. Let's just have a look.
Maybe does it need to make me host?
I have put you as host. Bear with me 1 second. Do you want to just try again for us and see if you can get your slides up? Yeah, there we go. Perfect. Yeah.
Get there in the end.
No worries. Just didn't want to see your inbox by mistake.
No, thank you for that. Can everyone see that opening slide now?
Yeah,
everyone?
I can see
yeah,
that.
perfect. Okay. Thank you, Zain, for the introduction, and thanks to everybody for having me along today. Quite similarly to Mehmet, I'm going to keep this quite succinct, really. If there are any questions, verbally or in the chat at the end, that's absolutely fine. So, yeah, I've just come along today to give a little bit of an overview about Child Bereavement UK and my role in Greater Manchester specifically, because my role is a little bit different to that of the national roles within the wider organisation. So Child Bereavement UK, for those of you that aren't already aware, we're a national charity and we support families if a child grieves or if a child dies. And obviously thinking about the reason why we're here today in terms of mental health and children, young people, I think sometimes it's really easy to underestimate the impact of grief as a trigger point for that sometimes. And actually, when we think about the statistics prior to the COVID-19 pandemic, so these will have increased quite dramatically from then, we were looking at 1 in 29 children were bereaved of a parent or a significant person. And like I say, that was prior to COVID. So we were looking at 1 in every classroom on average, which, like I say, has no doubt increased now. So our support is therapeutic support. I am a psychotherapist in my other world, and I'm a bereavement practitioner in Child Bereavement UK, and we support families, as I say, if a child bereaves or if a child dies. So we support children and young people up to the age of 25. We class a bereaved young person as anybody up to the age of 25, and we also support adults if they've lost a child as well. So it's from both aspects of that grief process. And another offer for Child Bereavement UK is we provide training to professionals in any organisation, in any field, anybody that is working with children. We think it's so important that people are upskilled as much as they possibly can be and empowered to best support bereaved children and families. My role, as I mentioned before, is slightly different. I cover the whole of Greater Manchester in my role. I am the only full-time member of staff as well. There's myself and my colleague who works alongside me 3 days a week. And our roles are funded specifically to support the Greater Manchester region, and also specifically to deliver training across the region as well. Child Bereavement UK do have a specific training department with some real in-depth training courses on offer that are at cost. I would invite people to go and have a look at our website for more details around some of those courses. But in my role, in the funded role that I sit in what is known as the North Outreach Project, I'm able to deliver 1-hour sessions to any school, healthcare setting, social care setting, for free across the Greater Manchester region. So that was really why I wanted to come along today, just to really highlight that. The sessions are free and they're all delivered online, just like we are all here together today. So please, similar to Mehmet, what I'll do at the end is just pop my email address in the chat function as well. And if there's anybody at the end that thinks actually that would be really useful for your organisation, please don't hesitate to email and get in touch, and we can arrange a date in which I can come and deliver that for you. So I've kept the slides really simple, partly because I don't want to give too much of what would normally be in the hour-long sessions away, because then nobody would want those. So there's 2 sessions that I deliver. One is called Supporting Bereaved Children, which will more than likely be the session that most people here today would prefer to book for their organisation if that's required. And the other session is Understanding Loss, Grief and Bereavement, which is more of a general understanding around that topic and how that can impact not just children and young people, but adults as well. And it just highlights the difference in those 3 terms of grief, bereavement and loss. And it kind of goes into a little bit more detail about the differences in those as well. We look at some different models of grief in both of the training sessions that I deliver, and some of the real differences between some of the models of grief from way back when, and some of the way in which we think differently as a society around grief now. Thankfully, we've come an awfully long way in terms of our response to grief, but obviously there are different factors that play into that. And again, in the training sessions, we go into those in a little bit more detail. Things like cultural factors, things like the relationship that child or that adult had with the person that has died. And we do a lot of thinking about the continuing bonds that are very much there in those relationships. So again, just a slide to just give a little bit of a flavour of the kind of things that are shared in the training sessions. And this really is just something to take with you today, I guess. And it's just around what people need in bereavement. And this is not just children, young people, this is adults as well. And what we tend to find is that if people are well supported in their grief, if they've got an outlet for their grief, if they've got a really supportive school environment, a really good friendship circle, a really good work environment, we tend to find that they will go on to not necessarily need one-to-one therapeutic intervention to support them in their grief, because they're really well supported in that. Some bereaved people, children and adults, will benefit from some one-to-one support, and that might be whereby those networks aren't necessarily in place for them, or they don't feel like they can reach out to certain people. And what we actually find is very few children and adults do require further intervention to psychological support services. And I think that kind of goes against what we can sometimes believe. I think sometimes when we're faced with a bereaved child, we automatically assume that they will need some support for that, some really direct therapeutic support. And of course, there are occasions where that is absolutely the case. But this slide is just to kind of open up the thought processes to think it's not always the case. And actually, in an awful lot of the work that I do in my direct therapeutic work with children, I will get referrals and I'll make contact, and 9 times out of 10 there's a really, really great member of staff in that school that child has already got that relationship with. So me coming online once a month to work with them isn't going to be the best way to do that. So what I'll do is every fortnight I'll have that chat, I'll have that phone call with that member of staff and support that member of staff to best support the child. So it's just around thinking of other ways in which sometimes bereaved children and young people would benefit best from support. And as I said at the beginning, we do have quite an extensive website. I must admit it's changing every week, it feels like, our website. So I'm not going to verbally direct you on where to go. But as I said, do go on there and have a little scoot around and see what you can find. There's lots and lots of information about our direct support offer, some of the group support that we offer as well, and about our training offer. There's also some really good resources on there that are printable that you can use when working with bereaved children and families. And also we have our helpline that is absolutely there for professionals to ring if anybody needs support when working with bereaved families as well. It's not just there for referrals, for support to be made. And I really want to highlight that today because I think that's really important. I think when we're working in the roles that we're in, it's very easy for us sometimes to think that we must know the answers to everything and we must be able to, to cope and manage. And actually, sometimes we all just need a little bit of support ourselves on how best to do things. And that's absolutely what our helpline is there for. As I mentioned, I'll pop my email address in the chat, and very similarly to the helpline, I have no problem at all in professionals reaching out to me to arrange a phone call to chat through things if that would ever be any help for people. That's a big part of my role as well. Equally, if my email is just there for people to reach out to book the training, that's also fine. And I'll pop that in the chat for you. I think I've kind of covered everything really in terms of the offer as a whole and the North Outreach Project offer. But if there are any questions, I'm more than happy to answer them. I'll just come off the screen so I can see people.
Thank you so much, Sarah. That was really, really insightful. I think I speak on behalf of everyone here. It's such a difficult topic to kind of broach, especially with children and young people, and just to know that we've got a professional in that kind of field who is sort of there to kind of support even just a few questions and take up the offer of the free CPD that's available, or to go on for the funded courses available as well. It's just brilliant to know that there's something out there for professionals to be able to tap into and use. I know that I'm sure I speak on behalf of everyone here. Everyone knows what it's like to go through a bereavement and how difficult that is, even as an adult, and as a young person, it must be very, very traumatic. So losing a loved one is something that we could all do with some support with. So yeah, let's say thank you on behalf of everyone. Really, really insightful, really helpful. Are there any questions for Sarah that anybody would like to kind of ask? Feel free to pop them in the chat, or please feel free to either raise your hand or to speak them out loud whilst you've got a bit of an opportunity to do so. Seems like you're off the hook, Sarah. Seems like everyone was quite content with everything that you've offered. Very thorough, I think. So really, really appreciate you spending your time with us this afternoon. So thank you. Feel free to stay on the call if you'd like to hear the rest of what we're offering. If not, you're more than welcome to go away. So
Great, thanks, Zain.
no worries at all. Thank you. Right, I'm just going to forward ahead to back to where we were and introduce our. We were flying through it. We were scheduled in until 3 o'clock, but it doesn't look like we're going to go all the way until 3 o'clock, by the way. So just a heads up, we'll probably be ending a little bit earlier. We've gone through a lot of content already. So I would like to take this opportunity now to introduce Dr. Libby, who is here through Wellbeing Through Sport. Very recently come in contact with Libby, and I'm really excited to present to you, or for her to give the opportunity to present what her offer is, what their offer is to Wellbeing Through Sport. It's something I'm quite passionate about. It's something that healthy schools have many times tried to link up the link between well-being and sport, and how physical activity and mental health are so closely linked together. We've got a professional here to be able to kind of talk to us about that and talk about their offer and support. So I'll hand straight over to Libby. Libby, are you able to take control? Yes, I think you just have. Yeah. Oh, I think you're on mute still.
I needed to unmute myself as well as take control. Sorry, I can't multitask very well.
No
Hi, everybody. Thank you very much for having me here today. I'm Libby Artingstall, and I'm here to tell you about Wellbeing Through Sport, which is our Manchester-based organisation. I'm a founder of Wellbeing Through Sport, and my background is I'm a medical doctor, and I specialise to become a consultant forensic psychiatrist. But over the last 6 years, I've been working my work has been focused on what we can do to prevent mental health problems from developing, and what we can do to promote really good mental health and wellbeing in children and young people. And got 2 co-founders who can't be here today, but Sheila McDade, who's a consultant child and adolescent psychiatrist, and Chris Irwin, whose background is he's a professional rugby player who then became a PE teacher and subsequently a school leader. And we've worked together to develop Wellbeing Through Sport. So I'll just tell you a little bit about that. So in a nutshell, Wellbeing Through Sport is a universal health promotion programme where we work to promote really good mental health and wellbeing, build resilience and tackle childhood obesity. The Wellbeing Through Sport programme is a really great way to practically deliver some of the elements that are likely to form components of your whole school approach to mental health and wellbeing as a consequence of your senior mental health lead training. So I don't need to tell any of you here these next couple of slides, but it just provides context. So we know that unfortunately there's been an increase in the number of children and young people experiencing mental health difficulties, going from 1 in 10 to 1 in 6 over just a 4-year period, which is obviously of concern to us all. But on a positive note, what researchers have recently found is that there's about a 10-year window before the features of mental health problems, particularly in relation to self-harm, there's a 10-year window to intervene before them. So as well as sort of responding and taking action to support those who need it, we can really shift towards taking positive, proactive, preventative action, and it's going to have a huge impact on the mental health and wellbeing of children and young people that we're working with. The researchers have also found that programmes which build self-esteem can make a huge difference as well in terms of really sort of supporting good mental health and wellbeing and reducing things like self-harm later on in life. But we're not just interested in mental health and wellbeing, it's a critical thing of what we do, but we're also interested in physical health and wellbeing, and we believe you can't have one without the other. We understand the massive benefits that physical activity can have for both our mental health and our physical health, and we want to sort of bring the two together. Physical activity is really important, and we don't have enough. Obviously, one of the consequences of that can be obesity in childhood, and sadly, childhood obesity can be a cause and a consequence of mental health problems. So we really do need to sort of tackle both together. And unfortunately, ahead of COVID, we know that childhood obesity was described as one of the biggest sort of public health challenges of the 21st century. And during COVID, we saw a reduction in physical activity and an increase in childhood obesity levels. So Wellbeing Through Sport is about thinking about both of these things. So how do we do what we do? The crux of the Wellbeing Through Sport programme centres around what we call core life skills. And these are social and emotional life skills that we know are really, really important when it comes to preventing mental health problems and promoting good mental health and wellbeing in children and young people, but also adults as well. And actually, in my clinical role, working as a consultant psychiatrist, I spent a lot of time trying to work to develop these skills with some of the patients that I was working with. There's a big evidence base regarding social and emotional life skills and why they matter. And this includes preventing mental health problems, as I've said, building resilience for life, but also things like improving learning, increasing school attainment and completion, enabling higher earning potential, reducing risky behaviour, and they're also associated with less involvement with the criminal justice system. There's an evidence base with regards to how social and emotional life skills should be taught, and if it's to reach hearts and minds, as well as affect sort of values and attitudes, we know that learning needs to be experiential, interactive, stimulating, developmentally appropriate, positive and solution focused, and taught explicitly through the curriculum. And in our minds, and the premise of Wellbeing Through Sport is, what better way to teach and develop these social and emotional life skills than using sport and physical activity to do so. So our school-based approach comprises 3 key elements. So we have online CPD staff training, we have fun lesson plans and resources for children in years 1 up to year 9, and we also have tools to support whole school community participation around mental health and wellbeing. So I'll talk a little bit about these briefly in more detail. So we do offer senior mental health lead training. Our primary school senior mental health lead training has been quality assured by the DFE, but I'm aware that many of you have sort of completed that already through your links across the Manchester network, which is great. So I'll move that to the side, and then we've got 2 other modules that are available. So there's a masterclass online training module for members of the senior leadership team or staff members who have a particular interest in mental health and wellbeing. And this is all about promoting positive mental health and wellbeing in pupils, but also staff members, because we know how critically important that is. And then we have a shorter foundation training module, again on promoting positive mental health and wellbeing, and focusing on these social and emotional life skills. And to be able to deliver the lesson plans to pupils, it's a requirement to complete this online training. So our lessons and resources, we provide, our lessons come as an online PDF. Everything can be accessed through our website, but we also provide hard copies of these lesson plans and reflection task activities. We provide emoji frisbees to support the programme delivery, and posters for classroom display or assembly hall display to sort of really embody things, mental health and wellbeing, across the ethos and culture of the school. Our lessons have the same structure. They start with a classroom-based activity, so we introduce the social and emotional life skill and the lesson learning outcomes, and then we move outdoors or indoors, depending on the weather and facilities available, to enable the pupils to participate in a range of physical activities that are designed to help them understand and develop social and emotional life skills. And then we have a classroom-based reflective practice to help the children think about and reflect on the social and emotional life skill and why that might be important to them in their lives moving forward. We've mapped all the lesson plans that we have to the recent RSE curriculum, but given the content and the way we've presented it, they align with the PSHE curriculum and also the PE curriculum. So this allows flexibilities within school as to when the programme is delivered. And then finally, the whole school community participation element of things. So through our website, freely available to all, is our Wellbeing Through Sport community hub. And within this, there's 2 free online CPD mental health awareness training modules. One which is centred around children and young people's mental health and wellbeing, and one which is relevant to workplace mental health and wellbeing. And we also provide a free activity programme for children, young people and families to complete at home. So regardless of whether or not a school would like to take on the full Wellbeing Through Sport programme, the Wellbeing Through Sport Community Hub is available to all at no cost at all. And if you are interested, please don't hesitate to get in touch. Our website is wellbeingthroughsport.co.uk. You can reach us by phone or email, or I'm happy to take questions or come and meet to discuss if that would be helpful for your school. I think that's me done. So if there's any questions, I'm happy to take them, but don't worry if not. Thank you very much.
Thank you so much. Thank you so much, Sarah. We really appreciate you spending your afternoon with us. I, for one, like I said, I'm really excited to have sort of met you and to kind of have gone through this your project with you, because I think it's, as we said before, we spoke many a time. I can see Heather nodding already. We spoke many a times within our team that we are desperately trying to find that link between physical well-being and mental well-being. I think it's such an important link. You do good to feel good, and I think that's some of the key things that we're trying to push as well. And then within the Manchester demographic as well, we're seeing that weight impacting on health is a big thing that's coming through our school nurse referrals. So it's one of those things where we're trying to kind of have a two-tonged approach to it. So really appreciate your offer and everything you're sharing with us today. So it's definitely something I'll be pushing for schools as well. So if anyone's got any questions, I saw a question just pop up in the chat. Sorry, what was that? It was, could you share the phone number, contact details again, please? Yeah, Sarah, if you don't mind just popping in your contact details into the chat and your telephone. Well, I can share the slides again. I need the slides anyway. And then you can get the contact details from there as well. Are there any other questions for Sarah, particularly to do with the program or anything like that? See, here we go. There's the slide that I think people were after. So I'll leave it on there for a minute or so, and people can take a minute to jot down those numbers. Is there a lot of equipment needed to complete the activities? That's from Luke, Sarah.
Libby, you keep calling me Sarah.
Oh,
Libby.
sorry. I was too.
It's
I'm
totally
so
fine.
sorry. That's really rude of me. No,
no,
Libby.
it's not at all. It's fine. The equipment you would schools will have them all already in place. So it's kind of using regular sporting activities that would be completed in school. We've kind of adapted those to develop the core life skills. We do send. I can bring the we send these frisbee emojis form a big part of what we do. So we do supply you with those because we don't expect schools would have those as well. But no, nothing in particular.
Brilliant. And then another question just come from Ruth saying, is the cost dependent on the size of the school?
No.
Okay, so it's just a flat rate.
Yeah, there's a slight difference between primary and secondary, but no, it's just a flat rate, and then all members of staff can access what online training they wish. That's
brilliant. That's great to hear. Any other questions? I think we might be good for now. If there are any questions, obviously, please feel free to shoot it towards me and I can pass it on towards Libby. Or feel free to contact Libby yourself. Her email address is there. It's the inquiries at wellbeingthroughsport.co.uk, and then the number is there as well. I don't think Libby did, but please feel free to get in contact with her and Libby can share the cost details with you directly. So please feel free to do that, Lindsay. Thank you so much. So I will now pass over to the fantastic Olivia Osborne, who has worked tirelessly. She's shaking her head instead of nodding. She's far too humble. Who's worked tirelessly on the pathways that have been developed recently for the Manchester School Health Service. So it is, I'll let her kind of talk to you about, I was going to steal all your thunder then and tell you, jump in and take Olivia's slideshow, but I'll let Olivia do that. So Olivia, please feel free to take control. Olivia, we've not heard a word you said so far. You're on mute.
Great start. Good
Try
afternoon. Thank you for that introduction, Zain. Wish I would turn my camera off now, I've gone all red. But thank you very much. It's really nice to be here this afternoon to speak to you all. I might know some of you from being in schools previously. But yeah, my name's Olivia Osborne, and I am currently the clinical mental health lead for school health. So what I'm going to be doing is sharing with you a presentation. And first of all, we'll be looking at the referral forms that are new to school health. So hopefully you'll have seen them and you've started using them. And then I'll be running through the actual sort of toolkits that we're going to be using with young people in high schools, if that's okay. Any questions, please just put your hands up. If I can't see you, I'm sure Zain will let me know if there's any questions, or put them in the box. So the new referral criteria, I'm sure you've all been sort of notified that there's some changes from school health in terms of what we were offering to primary and high schools. So these are the new forms. This is the primary school referral form. So we aren't currently sort of supporting young children in primary schools with their mental health as part of our new offer at the moment. You know, I really strongly encourage you, if there are mental health concerns in primary schools, to sort of consider what's on offer in your schools. It'd be great for me to know as well, at some point, if I can reach out to yourselves after this session to find out what exactly is on offer in schools, because I know it really does vary, and I know you can offer some amazing support in your schools themselves. I know that some of your schools have sort of mental health services within schools as well, so I know that you'd be in close contact with them if you needed to. And also, if there's sort of whole school approaches, there's contacting your Healthy Schools coordinator, Zain and Heather, if there's any concerns. And I can put my email in the chat as well at the end of the session. So if there's any really pressing concerns, then please do get in touch. So for secondary schools, again, our referral criteria has changed slightly. So in terms of mental health, we are accepting referrals now for anxiety, low mood, and self-harm. So for self-harm, for school health nurses, we've already had a pathway in place for quite some time now, so we follow that anyway. But as part of my role, when I came into this role earlier this year, there wasn't sort of a pathway in place. Zain had started that project off really well, so I sort of took over on that pathway when I first started my role, and I asked staff what the main concerns were coming through high schools, and the top sort of 3 concerns that were sort of predominantly coming through referral forms were anxiety, low mood, and self-harm. So that's where I had to sort of choose that focus really. So that's why our referral criteria is specifically around that. So I'm going to go through our pathways. I'm not going to go through this in fine detail, don't worry. But this is generally how they look. So if you refer a young person in for anxiety or low mood, and we accept that referral, it's just as a quick note before I forget, it's really useful from schools to sort of let us know what else is in place for that young person in higher school. Some recent referrals that we've had in when we've gone out to see the young people, they're already under a lot of different services as well for their mental health. So the form does ask what other services are currently involved. So whatever, if you're aware of other services the young people are under, it's really good for us to know that. So that'd be brilliant. So given that we accept the referral, and it goes through a bit of a triage system, and then we sort of allocate it out weekly, what we do is we sort of look at that referral, and then we sort of, what we're going to be offering for anxiety and low mood is 4 sessions. So I'm not going to go, I'll go through sort of briefly what we do in those sessions, just so you're aware of what we're offering. At the end of those 4 sessions, hopefully for some of our young people, we'll be able to discharge them with some tools and sort of skills in place for them to maintain their mental well-being. If not, if we decide at the end of those 4 sessions that we feel they need some more help, or the young person themselves feel like they need some more help, we can then look at referring them on to other services and getting them that additional support. And of course, and that is happening already so far. Some young people that are on the pathway, they're needing some additional support at the end, so we can look into that. And this pathway is very much at the beginning stages of being used. So I'm very much wanting feedback from my colleagues in school nursing, but also from yourselves from schools. Please, if I give you my email, give me some feedback. If you're getting feedback from students or anything like that, I'd really sort of appreciate that, so that I can make this as good as it can be to work to help us support young people. It might be during these sessions that we indicate that the young person needs more help, because this is sort of for that very much that low level, low mood and anxiety. If we feel that that young person's got a lot of need there, then we can look at getting them some additional support. I am very conscious though that if we refer young people on to say CAMHS, fairly early on in these sessions, there is that long wait for CAMHS. So I am in sort of discussions already about sort of what support we can provide them in that interim period. So the anxiety toolkit, I'm going to just briefly run through how that is going to look. So it's a bit of a toolkit that the young person, it's very much focused on them being a massive part of sort of filling this in and taking part of that ownership of their own health and making those decisions with the school nurse. So the first session looks a bit like a psychoeducation, a bit of a body mapping exercise. understanding for that young person of what anxiety is, what it means to them, what's going on in their life. And a bit of a running theme throughout the sessions that I wanted to sort of embed is that sort of focusing on the basics to their well-being. So getting an idea of their daily lived experiences, which is what we would do anyway when we meet young people, sort of getting an idea of what life is like for them. And I wanted to sort of pinpoint sort of from early on in the beginning of the pathway how important those basics are to that young person's mental health. And I must also say that I did work on this with mental health practitioners to sort of get their approval on this and their expertise on working on this document. So yeah, it's involved in sort of exercises, a bit of education, getting them to sort of take part. And I've had some really positive feedback so far on young people using the sessions. For every session, they have to sort of fill out some outcomes of what they've achieved from each session, which has been some of the feedback I've been getting so far is really good things that young people are picking up on during the sessions, things that I necessarily wouldn't have thought of, so really good. And it kind of, again, gives them that ownership, and we can sort of feedback in the following sessions what they've learned from it and sort of gain an understanding of how they're feeling in those sessions and what they're gaining from it. And then another sort of activity is for them to complete a wellbeing log every week. It may be that these sessions are weekly, it might be that they're fortnightly. Again, that's very dependent on the young person, something that I'm sort of evaluating. So the wellbeing log is just, again, bringing those basics to their wellbeing into account and looking at how their mood has been on those days. And then we can have those discussions with young people in the following sessions and sort of looking at what's gone on for them in that week that may have been affecting their mental health. So session 2 is a bit of a stress bucket exercise, so sort of looking at healthy and unhealthy coping strategies to their mental health, and a bit of a problem solving skill, which I've been, again, good feedback from young people that they really like that sort of problem solving and working it out by themselves. And, you know, depending on how busy their stress bucket is, which again massively varies, they can then use those exercises to break down some of those worries and hopefully help reduce some of the anxieties that they've got in their life. And then session 4 is a bit of a sort of feedback session, really, evaluation of how they're doing, looking back at the different sessions. You know, we can sort of revisit some of the sessions if we need to as well, and sort of gain an understanding of where they're up to at that point, and constantly checking in on each session of how they're doing. Obviously, regardless of what session it is, if their mental health is deteriorating, then we would take action there and then to make sure they got the right support. But at this session, hopefully we're getting some feedback about sort of hopefully some of the skills that they've gained over those sessions as well, and how they're feeling, and putting a bit of an action plan into place, which my plan was that some of these sessions will be feeding into this action plan, building up those sort of skills of who their social networks, who they've got around them, skills that they've built up to help with their mental health. And at that point, hopefully they will be discharged from school health, and we would let school know. But also at that point, we might decide together with the young person that they need some additional help. I feel like I may have missed a section off there. Sorry. Sorry about that. I think I skipped a session. So before the evaluation session, my apologies, is focusing on those wellbeing basics again. So my plan at this session was that young person would bring back their wellbeing logs, and then you can look at them overall to see how they've been doing over the last few weeks, and sort of then really focus on the basics and have really deep discussions about each of those and how important they are to sort of maintaining good mental health, and how when we're not feeling great, they're the sort of things we start letting go of. And then there's some sort of breathing exercises there and some grounding techniques. These are going to, again, vary. We may add to these because they're not going to always work for every single young person. But again, I've had some feedback that young people have been finding them really useful. So that's really positive. So that's the anxiety session. Sorry for that confusion. And then the low mood pathway is very similarly set out in terms of the 4 sessions and evaluation at the end. So the low mood toolkit is very much based on that sort of positive mood cycle, and looking at what low mood is for them, again, looking at their daily lived experiences, looking at sort of what's really important to that young person, focusing on the positive. And again, very similar to the anxiety sessions is that wellbeing log and the outcomes. And it may be that some of these sessions interlink. I was working with a young person with my colleague recently, and she was doing the low mood toolkits, but actually she very much overlapped into the anxiety as well, and would have really benefited from some of the sessions as well. So we can sort of use them both alongside each other. So it's very much focusing, it's a bit repetitive, the low mood sessions, but that's what sort of information I got from mental health practitioners, is that repetition of sort of doing more to feel better. So that's what this is all about, really, sort of planning activities, making robust plans, sort of more likely to stick to them, thinking about what's important to them, what makes them feel good, and sort of, you know, doing more of that. And session 3 is the same as the anxiety one. So looking at the basics, again, having those conversations. And then again, session 4 is the feedback session to hopefully get an evaluation of how it's working for that young person. So like I said, at the end of those 4 sessions, we would hope for some young people that we can discharge them with those skills to, you know, to continue using them in daily life, just to help with their mental health. I'm sort of going to look at sort of a period of time where we would then revisit those students to see how they were doing, making sure sort of checking in with them after a period of time to make sure to see how they were doing, whether or not they kept being re-referred back into the service. But that's something that I will be looking at. And if they do need additional support, that's when we're looking at referring them to the services. So we have a bit of a mental health services directory that hopefully you've seen as well, with sort of referral forms in and contact details and referral criteria for different services. And obviously we'll be liaising with yourselves in schools and seeing what's on offer for young people. Obviously the Thrive hubs, which are across Manchester, they're a really good resource for us to tap into as well. If you're not aware of them as well, we can also signpost that information, but they're really beneficial for young people from children from 5 years on. They take referrals for, so they're really good in terms of supporting young people and children and families with mental health. And staff can sort of come and discuss with me and with Zain and Healthy Schools if there's any additional support that's needed. And then just briefly on self-harm, like I said, we currently have a pathway in place that's been due for review this year, which is what I'm currently working on now. So we'll be retraining all the staff around self-harm and safety planning alongside mental health practitioners. And that's it. Any questions at all? Absolutely fine.
Thank you so much, Olivia. Really appreciate that. And that was just, we wanted to share that with you as sort of the mental health leads in schools, just so you're aware of when you make a referral into the school nursing team, what is it that the nurses are going to be doing with the children that you're referring in, if the referral is accepted, because sometimes staff can be a bit in the dark. They've made the referral has been accepted, but they're not quite sure as to what is it that the young people are going to be going through. So now, hopefully, by sharing those resources, you've kind of seen what the anxiety pathway looks like and what the low mood pathway looks like, and then some information about the self-harm as well. The referral criteria is quite tight. And then we've just been asked by the school nursing team to kind of remind mental health leads and remind staff that to sort of be quite mindful when filling out the referral form and to make sure the appropriate details are there. Sometimes there's a lot of missing information, and then that can make some complications when it comes to referrals. So just to kind of remind those messages again. So thank you so much, Olivia. Really, really appreciate you spending your time and sharing all the hard work you've been doing. Thank you so much. And finally, I think it is over to me now for the last part of this network meeting. Really appreciate everyone spending their time with us this afternoon. Thank you so much for your patience and kind of sitting through all these slides and hearing about all the information. But I do hope you found it quite useful. So I'd like to begin by talking about our inclusion and anti-racism project, which is titled Be an Ally, B as in the Manchester B, if you didn't sort of spot that already. I didn't make the name up. It was a name that was established by one of our team members, but we've kind of all happy with it. So it is a project that was commissioned by Manchester City Council. It's as a sort of a direct response to just inclusion and anti-racism, the stuff that we want to kind of promote within the city. Manchester City Council are very, very keen. So it's commissioned by them and given to us to make this project. They're very keen for all schools, all primary schools. It's a primary project to begin with. We are developing the secondary one, but all schools of Manchester to have access to this training. We worked really, really hard on it. and all staff are welcome. It covers race and ethnicity terminology. So what is the difference between race and ethnicity? That can be a quite tricky one. Staff don't quite know that. What are different terminologies around what words are okay to use? Is the term person of color okay to use? Is the term black, is that okay to use? Is the term, do we use the term ethnic minority? Do we use racially marginalized people? What are the correct terminology to kind of use? Kind of helps you with your policies, helps you with your terminology around the classroom as well. The effects of racism on mental health. So how does racism and those sort of racist views have an impact on mental health and well-being? Defining and addressing systemic racism, what that looks like. What does institutional racism look like? What are we going to do to stamp that out? Then we're looking at the inclusivity stuff. So we've got the inclusivity of LGBT plus communities and the terminology around that. That can be a very broad and new area for a lot of professionals, sort of gender and sexuality and what it looks like, what's the right terminology to use, what does it mean to be agender, what different pronouns people have, what are the different sexualities, kind of what are they, do the different brackets do they fall under, looking at the protected characteristics and looking at challenging gender norms and disableism as well. So off the back of that, here we go. Our Be an Ally project is in full swing. We're delighted to see that a third of all schools in Manchester have access to training and resources so far. And we've had some great feedback. I've just pulled one bit of feedback because we've had loads. We've had like 60 pieces of feedback come through so far. This one was a particularly nice one that I'd share with you. Just wanted to say how much I've enjoyed watching your inclusivity training on Catch Up. So much I stayed in late an extra hour to finish watching it. You were very inspirational and informative in your presentation, and I learned a lot, as I'm sure all participants did. I thought your section on microaggressions was extremely thought-provoking and think a lot of this can be translated into the workplace setting as well as school. So that's just a feedback that came from another member of staff. So I just thought I'd share that with you. Some stats and figures, it's quite hard to kind of see there, but has your confidence in delivering anti-racism content increased since attending the training? Pretty much everyone, there's a 4.3 average rating there. Has your confidence in delivering LGBT plus content increased since attending the training? That's 4.5 there, rating on average. Do you feel more confident using appropriate terminology around race and ethnicity? 4.54 average rating. And then do you feel more confident using appropriate terminology around gender and sexuality? So that's a 4.54 rating as well. And then please rate the following statements. We've got a tiny bit of orange there, which we're hoping to work on, but the rest of it is pretty much all in the blues. So my presenters had good subject knowledge, pretty much all in the blue. My presenters used effective communication methods. The training has given me a useful insight to the topics we covered. I learned something I can implement in my school environment. So we have loads and loads of positive feedback, and we're getting loads and loads of schools coming in and joining in with this project as well. This is a fantastic resource package to support the project with lesson plans, resources and workshops. So there's an entire sort of resource pack available. The workshop and resources have been consulted on by the Right Honourable Stuart Lawrence and will be extremely beneficial for schools to use. To access the resources, we ask you to complete the training, which you can easily access as a pre-recorded session. Once you've completed the training, you'll be shown a link to complete the feedback, and then upon receiving your feedback, the resources will be sent to you. So to get access to the training directly, please contact Kat Bowers. So the email address is there. It's kat.bowers@mft.nhs.uk. Kat is on annual leave at the moment, but hopefully somebody else can pick that up. And then you'll be given the link to the training. Once you've completed the training, you'll get the feedback form. Once you've done the feedback form, the resources and all the lesson plans that we have worked quite hard on will be made available to you. So that is our Be an Ally project. That, like, once again, I'm saying Manchester City Council, speaking on behalf of Sharon Gardner here, is saying that she wants as many people as possible to kind of attend. And then our VoiceBox network, which is coming up very soon. So just wanted to highlight that as well. It's coming up very, very soon. VoiceBox is our school council network in which we invite schools to join in and contribute to national health campaigns. We're going to be focusing on Children's Mental Health Week for our upcoming VoiceBox network, providing your pupils in your school council ideas, stimulus, and through workshop. We'll be sharing and distributing all of the fantastic resources that Place to Be and other organisations offer, but along with this, we'll also be creating our own bank of resources. We're still working on this with the aim to release our resources in January, but we encourage all schools to sign up to our VoiceBox networks for the pupils. So the VoiceBox secondary event is on Wednesday, the 7th of January, 2022, and VoiceBox primary is Friday, the 27th of January, 2023. I think there might be one sooner than that as well, actually. I might have actually got the dates slightly confused it, but I can actually send out an email to what the dates are. And then Children's Mental Health Week is taking place on the 6th to the 12th of February next year. So please look out for the resources that are going to be made. Heather is working very, very hard on those resources as we speak. That has been her first task joining our team. So she's putting all different resources together for you guys that we're going to be putting out early January, hopefully, for you to access and use alongside the Place to Be resources that will be available as well. So a question come up in the chat. Give me 1 second. Are they still virtual meetings? Yes, we had an overwhelming amount of schools saying that they preferred the virtual, just made it quite a lot easier for schools to join in. So they are still virtual for now, and we'll hopefully reviewing that with the hope that the big event that we do, which is the big health challenge, that is the one thing that we're asking all schools to come and join in on face-to-face. It's nice to kind of get everyone together. And then finally, a last plug from me. These are my trainings that I'll be delivering that are coming up soon in chronological order. So next week, I'm doing engaging with parents and carers about mental health. So how you can support parents and carers with their mental health, how they can get on board with supporting their own children's mental health, removing the stigma around that. Then on the 10th of January, as a behind the behaviour training, so that's open to all professionals who work with children and young people. So it doesn't have to be a school setting. I'm doing supporting children and young people with anxiety. And on the 1st of February, we're going back to our setting up an effective peer mentoring programme. VoiceBox is in a couple of weeks' time. Thanks, Heather, for that. It's in Wednesday, the 7th of December, 9:30. So please feel free to sign up to that on our website as well. Any questions, feedback, and moving forward? Anything people would like to raise or anything they would like to say before we end today's network meeting? Just give people an opportunity to say so if there is.
Excellent, thank you. Really enjoyed it. So enjoyable, really interesting. So very useful for us. So thanks for everybody who's contributed. Appreciate it.
Thank you so much, John. We really appreciate you attending as always. So appreciate it a lot. And that is the end of our network meeting. So our next one is on the 15th of February. We are, just to give you a heads up, we are in talks of potentially pushing this back a little bit because we think coming back from the Christmas holidays to the 15th of Feb might be quite soon. So we'll keep you updated on that. But there's our email addresses. Have an amazing rest of the day, and please feel free to get in touch if you have any questions. So thank you so much, everybody. Take care. Thank you to all the guest speakers. And I'm sorry once again for getting your name wrong. Really, really sorry about that, Libby. Really, really apologise about that. But thank you. Thanks, everyone. Take care. Goodbye. Thank you all. Cheers. Thank you. Cheers. Thanks. Thank you, everyone. Just going to stop the recording.